we talked about missing teeth, and you explained very well the problems a missing tooth could potentially create. Teeth shifting in it and getting all crooked, and even making teeth in front out of alignment, teeth in front breaking because you're eating too much, biting too much in the back, in the front, because of the back teeth kind of missing. However, the biggest thing you mentioned is that it can create migraine headaches, neck pain, shoulder pain because of the hinges here, becoming basically overused and misused. You crook like a door hinge. One of them is missing, and the other one will then eventually, collapse. So, what are some of the major ways of replacing a missing tooth? We don't want to go into super detail because that's your job, and we're not so interested in it. But what we do want to know as patients is, what are some of my main options, and what are the pros and the cons of each one of them? What new inventions have there been, if there have been any new things at all, in terms of replacing missing teeth, and by doing so avoiding headaches, avoiding bad looking, avoiding not chewing, and all that stuff which comes with it.
Well, to replace the missing teeth, we go from dentures to implants. Dentures being the least expensive and implants being the most expensive. So depending on your financial situation, or depending how you would like to resolve this problem, we create a treatment plan. It is very important to replace the missing teeth, and once we start the treatment plan, you will see as we go ahead, you see yourself that which works better for you. I explain in my office pros and cons of dentures. Sometimes it's very uncomfortable to have something being removed every time from your mouth, and you eat, something gets under, or it's not that comfortable for the person. There are also bridges, if it's possible to replace missing teeth. If you have teeth, on each side of the missing teeth, then we can place a bridge. But again, if the teeth that's going to hold the bridge are good, healthy teeth, why would I prep them for the bridge? Meaning cutting a good, healthy tooth to create like a legs to support the bridge. That's the con of the bridge. And the best way to go are implants. The implants are replacing the actual missing tooth, going in the bone to create a root of the tooth, and then replacing with the crown. Very convenient. It doesn't, it stays there until, as long as you keep a good oral hygiene and see your dentist regularly, it stays there for the rest of your life.
I see. So you're saying the implant, in most cases, let's just talk about the bridge and the implant, because let's just say if there's one or two teeth missing, then a denture as such isn't really needed. Even though no. I guess you have this like just simple single teeth removable, I don't know what you call them.
Flippers.
A flipper. And again, it's really kind of like usually only if temporarily there's no money there to kind of like get you overweight. But I guess it does do the trick of keeping what you call the occlusion, keeping the mouth aligned.
Right.
Good.
And also it's preventing the teeth from shifting to different directions. So
right.
So create less problem.
Other teeth will not become crooked.
Other teeth don't move. Right.
Good. All right. And you're not using the front teeth to bite only, because that back tooth is there, even though it's
Absolutely,
a little uncomfortable. So now let's go to the bridge, which, as you said, you have two teeth and it's the one missing. You grind those two teeth down, you put a crown over it, and you hang a one in between, just like the Versano bridge,
right.
In it. And that has been around for a long time and has a great workability, right?
Yes, it works beautifully. The only concern is that we have to grind good, healthy teeth that are holding that bridge. Mm-hmm. So if we can avoid that by placing an implant, meaning replacing only the missing tooth it's gorgeous, it's beautiful. You don't have to ruin the other two teeth by just by grinding to hold the bridge.
Why? Because obviously if you have then 3 teeth together, so if you grinded them, so now there becomes a chance that one of those 2 teeth is going to eventually break also for whatever reason and from whichever part. Now you need to replace all 3 because they're all 3 connected.
All 3.
Yeah. Like
yes.
I learned that one time I was smart and bought some fax machine, which was a scanner, a fax, a telephone. It did something else, printer. So, and it's nice and dandy, except if one of them breaks, you have nothing.
The whole, yep.
So after it did break, I kind of said, you know what? Let's get all of them separate, so that the rest of the operation is still going on if one breaks. Now, is it true that people with a bridge, because it's kind of like 3 pieces or 4, depends on how many teeth are missing, are together, they're like literally welded together, they're made together, and now you have a hard time flossing in between. It's not possible. So you need to floss.
Right.
You need to thread it under. Now, let me give you a scenario. I go to the bathroom with my wife at night, and we start, brushing teeth and stuff. She is still brushing and flossing. I do the showering, the shaving. I'm done. And I sit there and say, so honey, well, how much longer? And she says, well, another couple of minutes with my flossing. And I'm already done with everything. So I would most likely be quite often not floss on that tooth. I would say, nah, not today, tomorrow maybe. And that then causes gum disease, which in itself is super bad, as you mentioned. But at the same token, it will now make that bridge failing earlier. Is yes. There some truth to that?
Absolutely. If you do not keep your bridge or teeth, anything, if you don't keep it clean, you don't clean under, the collection of food, it creates all the bacteria, which causes gum disease, and that gum disease causes bone disease. So you end up with your gum receding, your bone going down, and then the teeth get rotten under the bridge. You get a very bad smell in your mouth, and also you start to lose the bone that holds those teeth. Then you end up losing the bridge completely.
Right.
So now we are back to the problem where again you have to replace the missing teeth.
Right. Now you do of course have to floss and do all that stuff with an implant tooth also. It's just a little easier and of course
it is actually much easier.
Right. Now my wife
is much easier.
My wife would probably do fine with a bridge because she's, dedicated to the detail, incredible. But some of us are not, and then the implant. Is there any data that the implant really lasts a lot longer? Have it been around for so long that you can say yes, it does last, a long time?
Yes, it's actually been around for, I would say, over 40 years now, and it's becoming more affordable to people. It is less expensive. It is much more affordable. It is, before it used to be very limited doctors who did it.
Right.
Now it's, widely spread, and we can place implant in the placing an implant is easier than taking a tooth out. So I give this consultation with a patient. We have a huge discussion about it, so patients understand all the pros and cons, and they see how much easier and better it is to have implants versus bridges or dentures.
Right. Well, the technology probably, as you said, more doctors using it, like with everything else. As cell phones in the 90s were, a lot of money. Now they give them to you for free, more or less. And so that it's that type of things, the material become better. I think you guys are using titanium the same way they use for hip implants, hip replacements, right? That's what you're using.
Yes. We use titanium for implants, yes.
Right. Now,
go
ahead.
And I want to mention that the price for implant is very close to the price of a bridge. So why would you, pay that much money for the bridge when you can get an implant and not ruin the teeth that holding the bridge?
Well, it makes sense that it is. And I'm glad you mentioned that. It makes sense that it is because on a bridge, you need 3 crowns. You need 3 ceramic caps, so to say, and they cost money. And on an implant, you only need 1. So that's why actually, the price, there is no real difference, you say, right?
Right, because for the bridge you're paying for 3 for 3 crowns, but for the implant you're paying for the implant itself that goes inside your bone and for the crown that's holding it. Mm-hmm. So that's why the price is very, very close to the bridge. So I would
And what about the bone loss? When you have an implant in it, even if it's it is a fake thing, it's a metal stick in it, but it resembles the root of the tooth for the body. So the body thinks there's a tooth in it, and then the bones are not shrinking, where when you have a bridge, those 2 teeth in between, or where you don't have a tooth, where just the bridge is hanging down, the gums there have a tendency of shrinking. Is that right?
That's right.
The bones, actually, not so much the gums.
The bone, right, because the gum is shrinking with the bone. Again, it's only because of the oral hygiene. If you don't keep clean under the bridge, it gets all the bacteria, and the bacteria causes destroying the bone and the gum, and that's the reason.
Well, wonderful. Very, very informative. We now know, and the technology has improved, because we still keep hearing implant, and automatically we keep hearing you want me to buy a Ferrari. I don't want a Ferrari. I don't want such an expensive car. I just want a car which gets me from A to B. Well, the implant is a normal Volkswagen, a normal people car, and it gets you from A to B better than the other thing, and it doesn't have the price of a Ferrari anymore. That's basically what you're saying.
Yes.
Beautiful. And that doesn't even count that if you have to replace the bridge, that is money and hassle on top of it, where the implant doesn't, in most cases, ever have to be replaced anymore.
Most of the time it doesn't. There are some conditions, of course, concerning your health, general health, if you have diabetes,
Sure.
not controlled diabetes, or very high blood pressure, something like that. But we all discuss it at the
Right.
consultation, and we take everything into consideration. But otherwise, a healthy, controlled person has no problem having an implant for the rest of their lives.